My name's Kelly Colopy. I'm the Director of Health and Human Services for the City of Long Beach. I've been here for about 7 years doing the work within our city.
Kelly, tell us a little bit about Health and Human Services, and we're here at the Grand location, but
Yeah.
I know you have other locations. What happens here at the headquarters, I would think, of Health and Human Services?
Right, so we refer to this building as Main Health, like the main health facility. And in this building, we have our clinical services, our public health lab, our emergency operations, as well as a lot of our administrative spaces. So environmental health operates from here, a lot of the planning for public health nurses and others. So there's a lot of folks, there's about 100 people that are located in this building.
Okay. And today, what do you think we'll be taking a look at? I know things have changed dramatically. I mean, obviously, you're wearing a mask. We're all under COVID regulations and guidelines, but this really was a hub for quite a few visitors, I would think, in addition to your other locations. But what are we going to see today that's still functioning and is important for folks to know?
Yeah, so everything continues to function. They just function a lot of it from off-site. But what we'll share today is we'll show like where our epidemiology and all of our contact tracing and everything efforts are being housed. Now they're all out. Many of them are working from home, but it'll at least show you what we call this our Department Operations Center. So we'll head in there. And then we run a public health laboratory, and so that is where some COVID testing is taking place, as well as testing for a lot of the other work that we do. And then we have a WIC clinic. So this is our largest women, infants, and children's clinic, and they continue to operate. People don't come in; it's all by phone, but they still continue to work in those spaces. And then we can go down and tour a clinic. So we run a number of different clinics around HIV and STD, family planning, immunizations, and others. And we can go and visit just one of the clinical settings. We really haven't had them open as much during this COVID time, but at least you'll get to see where we are.
Great. Well, let's get going.
All right. So we're heading into our public health laboratory. This is where we're currently doing COVID testing, but we also do lead testing, testing around West Nile virus and other things. So pretty much anything that would occur in a public health laboratory, we do here. But right now we're very focused on our COVID testing. This is May Amparo, and she runs our lab. She makes sure that everything works for us. So
Hi,
she's
May.
going to give you a little.
May, tell us a little bit about what's happening here.
Our Long Beach Public Health Lab supports the different programs of our health department. The laboratory is comprised of two sections, the clinical and the environmental section. For the clinical section, we have the bacteriology, virology, and molecular. And the tests that we do here are done for, the majority would be for our communicable disease control program, as well as our hospitals in the city of Long Beach. The clinical section is comprised of the environmental section. The environmental section is comprised of our lead processing area and the lead analysis. And the specimens coming to our lab are from our environmental health. They're collected from different housing for the detection of lead. Other specimens also come from individuals, companies who want their specimen tested for the presence of lead.
So you're doing quite a few things that are generated out of the operations. Is there any
of other
testing that
departments,
occurs
perhaps?
Yes.
relative to private parties sending you samples?
That happens for the environmental section only, because some companies want their specimens tested that they use for like construction. Before they do construction, they want to detect the presence of lead.
Okay.
But the majority of our environmental section is for our environmental health department, where we test beach water and dairy samples from the different businesses here in Long Beach.
So on any given and typical day, and I know we're not living in such typical times,
Anymore, yes.
but on any, let's start with a typical day, non-COVID, how many tests or samples, can you put it into some sort of context for us to understand how much goes through here on a daily basis?
Because our specimens are, the specimens we receive are under the Title 17, where hospitals are obligated to send us the specimens that are of public health issue. There's really no consistency, there's no routine. There are times when there will be outbreaks where we will have a lot of specimens coming in. There are times when we would have just a few, depending on what the hospital sent us.
Okay. And so now, you, as Kelly mentioned, you're open for business and testing. And has COVID has it increased your testing load?
Oh, definitely.
Okay,
Yes, it has.
I would hope so. I hope the answer was yes.
Yes,
Okay.
definitely, yes. And we're very happy to do a lot of like the COVID testing, not only from our programs, to support our programs, but also from the different hospitals. Sometimes we get requests from people in other jurisdictions that are investigated by our communicable disease coordinator.
Okay. And so, how many staff actually are here on a daily basis?
Believe it or not, there's only 6 of us, 2 lab assistants, 3 microbiologists, and 1 chemist.
Wow, that's quite a bit of work going through.
Yes, and each one we try to cross-train them within the regulations required by our accrediting agency. And that way we're all able to pitch in and help when there's an increase in the workload in one section.
So the walls of the health department are decorated through a campaign that we did around HIV and STD. So the city of Long Beach worked with the Pasadena School of Design to develop these posters, and they came to Long Beach and interviewed a whole lot of folks all over and got their stories, and then created a campaign called Dear Long Beach, which are stories from their interviews, and then created the artwork and others from them. So we have these all throughout the hallways.
So Kelly, these posters then, as part of this campaign, has that been launched formally?
It has not. So we were getting ready to start to launch it, and then just through COVID and other things, we've held off for a little while, and we're hoping to launch it in the future. But in the meantime, we make sure that as people when they're coming to visit our building, really have an opportunity to see the artwork and the stories.
It's wonderful. Great. Look forward to that campaign.
So this is the administrative office for our environmental health department, and so I guess I should say our environmental health bureau. And so the environmental health bureau, they do all the restaurant inspections, the water testing of the beaches. When you know if your beaches are open, that's because the samples are collected by environmental health and then taken to the lab, which you just saw, and they do the testing there every day to make sure that we're safe. They also do the vector control, so all the mosquito control work that you learn about, that's all going on. They're monitoring for West Nile and Zika and all the other vector-borne illnesses. You also get noise complaints. So this team actually follows up on noise complaints and does hazardous waste as well. So it does a lot of different work throughout the city, and most of them are out in the field most of the time. But this is the administrative space where they all come together in the end of it.
That is quite a busy group. I'm familiar with a lot of their work because of the calls that are typically made in the downtown being so dense. A lot of these issues come up, whether it's restaurants or vector control. And people see a little mouse on the corridor popping out of some vegetation.
We might get that call too.
And noise as well. There's obviously some impact from a dense environment, having sometimes residents that are new to downtown and are not used to maybe living right next to an entertainment district. Right. And it requires Environmental Health Bureau to actually help be a little bit of a facilitator or mediator between those two parties. Yeah. So a lot of good work here.
Yeah, they go out and they do tests for the sound, the noise, to determine whether it actually goes over what it should be and things, and then works very closely with local residents and businesses to be able to support them to make sure that everybody is living together in a space.
And is Environmental Health Bureau, are they particularly busier as it relates to COVID? Are they out there, like with the restaurants that are reopening, are they out there are they the responsible bureau then for checking in on some of these restaurants that are opening up and having outdoor seating?
Yeah, so they've developed a whole set of guidance for the different restaurants, and then we actually have a venue task force, which is partly code enforcement and partly environmental health. So they're going out together every day, and especially on weekends, and working to make sure that our different businesses are following the protocols, helping to educate them as much as possible, and working very closely with them. They have put a lot of guidances, a toolkit, and other things to really support the businesses in the COVID times.
That's fantastic. Thank you.
So the health department works very closely with people to enroll them into health insurance, whether it's under Covered California or under Medi-Cal. So this is our place that people would go and make an appointment, and then we work very closely with them to help them connect to the right insurance level for them, to help work out any issues they may have in registering and other things. So a lot of this is happening right now online because we are trying to keep people at home as much as possible during COVID, but this is often has people sitting and waiting, and really we're doing everything we can to support people to have access to healthcare.
And for those who don't have online access right now, is there a option?
There's a
for
phone
them?
number, yeah, so people can call and we work through them over the telephone for sure.
Fantastic.
Yeah. So this is our Department Operations Center, which is sort of the hub for all things around communicable disease. So right now they're very, very focused on COVID. We normally have about 10 people as part of this office, and right now we've got 50 or 60 who are aligned. Many have been repurposed from the rest of our department, from other departments, and then we've hired additional folks to really be able to do all the case investigations, contact tracing, close work with our skilled nursing facilities, tracking all the data, all those things. That's all happening from the staff that's in here, as well as the public health emergency space. So we have a distribution center that they're running. All the test sites are organized and managed out of here. So all of these, like this room, is the hub for response. It's very quiet right now because we haven't sent. Many people are working from home and off-site just during this COVID time. But this is the space.
All right. So let's take a look. I noticed everybody's fairly distanced here, so we've got practicing our COVID regulations. It wouldn't be the health department if we weren't practicing our own health guidelines, so that's good, among others. Okay, so normally you're saying about 10 people in this office, but 50 now have been gathered up and redirected from other
Right.
offices in health,
Or hired or others to help support.
handle the workload.
Yeah. So happy.
Well, Kelly, you were mentioning that the number of staff have been repurposed, and that this is the operations hub for COVID and at the health department. And one thing you mentioned was tracings. Tell us a little bit about that.
So you hear a lot about contact tracing, and that's essentially when we find out that a person is positive, and then we contact them and collect a lot of some demographic information, but also who are those folks they've been in close contact with, so that we can then reach out to those folks and let them know they may have been exposed, and then work with them whether they need to be quarantined or tested or something like that. So Emily is doing that work specific to police and fire, and she's going to share a little bit about what she's doing.
All right. Hi, Emily.
Hi.
So tell us a little bit about that.
Great. So my name is Emily. Previously, my role was titled Disease Intervention Specialist, which is actually to limit the spread of HIV and STDs here in the city. In that role, it's very similar. I reach out and interview to those who have tested positive for specific infections, and contact people they have been in contact with during their infectious period. So very similarly, this is translated to the COVID transmission. We interview people who have tested positive, and my role specifically firefighters and police officers. We've determined when their onset was, when their infectious period was, and therefore then remove people as well as themselves they may have been in contact with during their infectious period to limit the spread of infections, both in the fire stations and in the police stations. From then on out, we hope that limits the disease transmission, and
Yeah, I appreciate that. That's actually really important. I think people have don't fully, I think they're gaining an understanding of contact tracing, but they're not really understanding how much of a role it plays in tamping down COVID-19 and trying to, as they say, flatten the curve, or so it's an important role to make sure that folks are aware. And I imagine that one particular case could lead you to 14 or I don't know, however many
Right.
leads.
So if someone continues to work while ill, especially in these stations where they're somewhat congregated in a sense and seeing these people on a daily basis, they consider these people to be their brothers and sisters in the workforce. Especially with that aspect of trusting one another. People continue to be in closer contact than they would with maybe people in the public. So if people continue to work while sick, we do see higher rates of transmission in those settings sometimes.
Right. So you really could, from one case, telling you how busy that person, that firefighter, was that day on calls for service, or police department officer, you could be contacting quite a few people, both in the department, but also out in the public.
Right.
Amazing. Well, thank you for the work you're doing.
Of course.
All right, so this is our WIC clinic that's at Maine Health. We have 5 WIC clinics around the city. We have them in North Long Beach, West and Central, and at St. Mary's. And so this is the main clinic here. So this is Stephanie. She is the supervisor of our WIC clinic, and she's going to share a little bit about what WIC does and go from there.
All right, Stephanie, tell us a little bit about WIC. What does that stand for?
Yeah, so WIC stands for Women, Infants, and Children. It's a federally funded supplemental nutrition program that targets low-income families. So it's similar to like SNAP or CalFresh, but it's also slightly different where, SNAP, they just give you kind of like a monthly cash value benefit, and then that's kind of it. But WIC, it's focused on specific like food staples, like whole grains. They get fruits and vegetables, and milk, cheese, eggs, yogurt, and kind of bundled into the food benefits that they get monthly. There's also a strong foundation of nutrition education. So that's a lot of what we do here. What the counselors normally do here is educating families on healthy eating. Parents have lots of questions on, my kid's picky, I don't feel like they're eating enough, or they only want juice, a lot of common questions that parents have. And so we really think that, early education, early intervention is really important to build healthy families. And the other part of that is it's not just women who are pregnant, but also women who are breastfeeding postpartum too. So we provide breastfeeding support for moms and education. We can loan out pumps, and we some of our sites we have breastfeeding peer counselor programs where they have support groups and stuff like that. So it's very different now. Everything's over the phone. They don't have in-person support groups anymore, but we do the best we can to do everything remotely.
So normally then, how many participants would there be in the WIC program in any one day, week, month, however you measure that?
Yeah, so I can't remember the caseload off the top of my head, but
the caseload around about 17,000.
Caseload total, annually.
Yeah, so because people are in for up to a year or so, but generally we run a caseload of 17,000 over the year.
Wow, that is amazing. And are they all Long Beach residents, or do you find them, did they come here from the area?
Yeah, majority of them are, but we've heard of some people, they come from Wilmington, Paramount, or they move away to LA, but they still come here because they actually really value the service and how they're treated here. So participants have told us that they do come from kind of perimeter cities to Long Beach.
And how is the WIC program funded?
So it's USDA grant funded program.
Okay. Thank you so much.
Yeah.
Appreciate it.
So we run a number of clinical services here in the department. This is the waiting room of one of them. You'll notice that the chairs are very spaced out thanks to COVID. And since it's a clinical space in the back, we won't go back there. But we run HIV and STD clinic, family planning, tuberculosis, and immunization. So all of those are operated here. We have nurses and nurse practitioners, and we have a doctor on site who runs our HIV and STD space.
So in any given day, on a normal day, not a COVID day necessarily, how many people would be coming through here?
We normally have, I think, approximately 50 people that come through the different clinics throughout, generally in a day. But right now, primarily what we're seeing is HIV and HIV patients, just to make sure that we're able to support them through this. And we're also doing a lot of phone supports for people who are our patients.
That's true. I think we are all so in rapture about COVID-19 and all the coverage that we forget that life doesn't stop for all these other individuals in our community.
Right. So we're doing everything we can to support the people that we normally serve throughout, and do like being in contact as much as possible and supporting them.
And Kelly, we talked a little bit about this, but maybe for our viewers, tell us a little bit about your funding sources overall for the Health and Human Services Department. How are you funded? Is it from general funds from the city or grants? How does that break down?
So the health department's budget is 85% grants. That's federal, state, and local. It's about 13% fees. So that's primarily environmental health. So fees for like restaurant inspections and others. And then we get about 2% of our budget from the general fund. So those funds focus primarily on the issues of homelessness, supporting our equity office, and a little bit of violence prevention.
So there's a lot of effort that goes into securing those grants, qualifying for those grants, reporting. I imagine that a lot of that funding has some regulation and related to. We sort of joke around that we run like a nonprofit. So we're sort of a mixture of a nonprofit, a medical facility, and then we are a government organization. So we do write for almost all of our work to maintain it, and it is an effort for sure, but it is the way that we need to provide our services. It's powerful, though. That's a pretty amazing and dynamic department in the city of Long Beach.
It is, and we're doing everything we can to be able to serve everybody within our city. And right now, we keep trying to put ourselves out of business, because at the time that we put ourselves out of business means everybody's doing well in our city. Unfortunately, under COVID, everything is shifting around. So the WIC that you just saw, those caseloads are going up. Our need, for connecting people to insurance is going up, plus all the other work to really support people so they're healthy and well.
Thank you. That's really important information. Well, Kelly, thank you so much for leading us through this tour. It was quite an eye-opening journey through Health and Human Services, and to think that you have so many other sites throughout the city that are doing this good work. I think that's great news for the city of Long Beach to know that its health department is covering so many different parts of their life and supporting them in so many different ways. Any final thoughts?
No, thank you for coming to our health department. So this is our main health. We have 8 other sites around the city doing different services. So you've been to the multi-service center already, but if you ever want to see some of the other spaces, we're happy to take you there as well.
Hey, Kelly, you had mentioned along the tour that there are ways that residents and businesses could support the Department of Health and Human Services. How can they donate if they want to help with some of these impressive efforts?
Yeah, so we actually have 2 funds. So they're both in the Long Beach Community Foundation. So there's a Health and Human Services fund there that those funds can come in and support the kinds of work that we can do here that maybe grants don't allow to cover, or for special things that people want us to focus on. We also have the Mayor's Fund for Homelessness. And so we do run the Homeless Services Center, multi-service center, and all the homeless response in the city. So that's another place that people can donate. Both of those are within the Long Beach Community Foundation.
And we'll make sure to provide that information to our viewers. Thanks so much, Kelly. It's been a pleasure.
Thank you.